Hello, everyone. I'm just going to give it a couple minutes for people to log in, and then we'll get started.
Hello and welcome to Redefining Workplace Wellbeing, a holistic approach to mental health. Thank you for joining us. My name is Tina Sharby and I'm the Chief Human Resources Officer at Easter Seals, New Hampshire and Vermont. And I have some friends that have joined me here today. I'm hoping that Glenn, Lisa, and Brian, you can introduce yourselves as well.
Hi, everybody. My name is Glenn Haskell. I'm the Benefits Director at New Balance Athletics.
Hi, everyone. My name is Lisa Singh. I'm the head of global benefits at Datavant.
Hi, everyone. My name is Brian Coleman. I'm Vice President of Global Total Rewards for Dawn Food Products.
Great. Thank you, everyone. I think we should just dive into today's topic. It's a hot topic amongst many of us. And so I'm kind of curious, what are you doing? What kinds of measures have you put into place to implement and promote mental well-being in your workplaces and into your strategic planning?
We're one of the first groups into the well-being space, and we started our journey in 2008. So a lot of this stuff, it takes time. It's not done overnight. From the global perspective and from the how does the company work, we are actually working on a well-being dashboard. We're testing it in the United States first, to where we're looking at our three pillars of our well-being strategy is resilience, financial well-being, and physical well-being. So what we're doing is we're actually looking at each one of those pillars, and then we are basically data mongers. We are gathering from every source possible to put it into, everyone wants to have a pretty 3-panel sort of thing. That doesn't really work. It doesn't. You've got to kind of build from the bottom and work your way up with executives because everyone has a different look of what they want to see. So from a resilience perspective, are you utilizing your EAP? We're at like a 6% utilization, which is monstrous, and how we got there. And we can talk later about communication. Or from a financial well-being, it's not just how much people are putting in their 401k or their RRSP in Canada. It's about a series of measures of what are they contributing? Do they have an HSA? Are they trying to get loans out of their 401k? So it's all of those things that we can kind of talk about. I kind of opened the big giant hole for everyone else, because if you can't tell on this call, we all have a passion for this stuff.
Yeah, and I think Brian hits it right on the head. It's not just one program, one initiative, one area. As you think of well-being, it is, multiple pillars, and it's looking at the whole person. So not just mental health, but also the physical, financial, as Brian touched on, social, community. It's everything across the board. And I think looking at it from that kind of holistic person, holistic well-being lens. And then as you look at the programs you offer, as you look at your company policies, and then as you look at your processes, how are you showing up to support employees across that holistic whole person perspective? And then you take a look at that and how does that tie into your company culture and values, and trying to get alignment across that. So it's not just one program, it's not just one initiative, but you need to look at every aspect of, what is your time off policies? What does your insurance policies cover? Medical coverage, disability coverage. How are you showing up there? And then how are you treating people, for example, when they're returning from a mental health leave? And how are you in bringing them back into the organization successfully to succeed? From those employee experience component. So I think you need to look at the total, and then where can you continue to tie everything together.
And I'll chime in. Totally agree, Lisa. It's really, people talk about employee benefits, and it was for years, it always was employee benefits. It really is. It's all about well-being. Every benefit program is about at least at New Balance, every benefit program is really a well-being program. Talk about your medical insurance, your dental insurance. It's all about the well-being and the welfare of the associates. In terms of the more, formal well-being programs that we've all talked about over the last 15 years, it's kind of morphed. I think if you go back 15 years, it was almost all totally physical well-being is what we all sort of focused on. And we went along with that ride too. I mean, we have the, like I think many employers, we have the full-blown biometric based program. What you pay for your medical insurance is based on, whether or not you participate in the biometric program, all that sort of stuff that I think a lot of employers have latched onto in an effort to try to enhance the physical well-being of their associates. So we have all that, but I think more recently, and I'll say over the last, say 10 years, say eight to 10 years, the definition of well-being has broadened out beyond the physical well-being to include probably financial well-being was the next to come in. And, a lot of us have done a lot of programming around ensuring the financial well-being of our associates. And then more recently, mostly spurred on by COVID, was the mental well-being, which really got supercharged over the, let's say, the last 3 years in terms of the new programs that people are offering. There's a lot of new vendors out there, a lot of new offerings that people are trying on the mental health front. So that's kind of our view of the landscape on well-being and sort of where it's morphed over the last, say, 10 to 15 years. But a lot of us have done a lot of work on it, and we're happy to talk about some of that programming over the next hour.
Yeah,
and one of the other things on COVID, Tina, that my esteemed colleagues hit is we're a 104-year-old company. So one of the things that rattled our cage and got us rethinking of the world again is it's not just about the team members. We call them team members. He calls them associates, employees. It is about the families. It is about whatever you call a family. In some cases, that is not the traditional norm as well. So it is that how do we take care of that whole unit so that they are with us today and they are with us for tomorrow and for however long. And they, their sons, daughters, significant others, family members all come to work for us as well.
Absolutely. It certainly has changed over the years from just being the biometric test and looking at the physical aspects of wellness programming, and now being very inclusive. And I do think COVID has really hit home the importance of looking at the individual as a whole and taking mental health in as part of that. And I think it is our responsibility to break down those barriers to discussions about mental health. I think that the more that we can do as professionals to bring this out in the open and have these discussions. I'm also seeing that we are now also including overall inclusivity and sense of belonging in our wellness programming and our mental health programming, because it's really looking at the individual as a whole. The family is part of that individual, their finance is part of the individual, how they feel that they belong and contribute, all part of the package. So definitely we have changed a lot, and just in a short period of time, I would say a lot of change has taken place. I'm kind of curious to, kind of delve a little bit more into this, is that have you spent any time really trying to evaluate the impact of your efforts? Like, how do you see that there's a return for your investment? Like, I know when I first started, we had a whole wellness program out there, and the first thing that our board asked was, what's the return on the investment? And it's really hard to measure sometimes. So I'm kind of curious, what are you all doing?
All right. So I'm making that pitch to the CEO next week. So I have all my numbers on my fingertips. So we'll go over the last 10 years. The medical CPI for the last 10 years has been about 3%, where swings in the marketplace in the States are 5 to 6%. We have been able, with all of our well-being strategies in place, to be at 4% year over year. So 1% over CPI.
Good.
So there is a lot of measurements that can happen. The challenge we always have is we have to look at how our organizations measure and how our finance teams measure so that we all can come to a common language. Because how they like to stop some of these is, well, you can't measure it. It's just frou-frou stuff. This is just good and plenty. In reality, it is not. It is laying the groundwork for the organization of the future. It is, it's not just a cultural imperative. It's not a social imperative. It's a business imperative, to where each one of our organizations are looking at how are we doing these things and how are we setting ourselves up so the next crisis that comes down the pike, the next COVID. So when we rolled into COVID, we didn't have to turn anything on. We had Teledoc, we had EAP, we had everything impossibly in place, including linkages into all of the social benefits that a lot of companies overlook, because it's not just your team members are part of your organization. They're part of society. They're part of a location, and, they're part of a region, and they all have benefits that we have to incorporate in to really do the best we can for them. Wow. See, you guys got me talking. Sorry.
And I think, as you're talking about, Brian, it is a different employee expectation. And there's a new norm of kind of that entry level of the basics of what employees are expecting companies offer now and provide. And that's changed and pivoted from what it was just pre-pandemic. And so it's, the ticket to get in the door, we need, the mental health support with coaching and counseling. You need, well-being policies, mental health policies. You need generous time off policies. You need that focus on the employee as you go through what does that employee experience look like? And so that's kind of table stakes now. And then when we talk about looking at evaluation of those, again, table stakes coming in, but you do need data and looking at whatever points of data you have available. Brian has great resources and insights. Not all organizations may be able to have the same data analytics. So what is your employee engagement surveys showing you? What's your turnover? What's the feedback from employees as they're leaving the organization? And then talking, as Tina said, about DE&I, benefits has a close partnership now. And I think this is a pivot going forward of kind of people team and HR teams need to work holistically together towards that employee experience. So what are you hearing from your employee resource groups? What are the business partners hearing? Where can you tap in to get quantifiable and quantitative and non-quantitative data to get the pulse of what's going on in the organization with your employees, and then how the programs you're offering tie in to support that or not support that, or if you're offering the programs, but again, basic utilization data, are employees engaging in the programs? What are your communication channels? Are you communicating and promoting it? Because the data may show that the program's not being utilized, but maybe employees aren't aware of it. So you have to look at that component as well, that you really need to take that kind of holistic look of what data do you have, where can you find it, but how are you showing up across the organization, and how are you working across HR, the people team, to get those insights and then listen to and figure out what you're hearing from employees through those various channels.
Love it.
And I'll just chirp in that at least at New Balance, we really there is no calculation around return of investments with regard to the introduction of new programs. That's not the metric. The metric is, will it benefit the associates?
That's so cool.
And I think that's a very healthy place to be. I'm blessed to work for a private employer where, we're not beholden to shareholders. So we're blessed in that way. But it's really about, if you're going to create your culture, right? If you're doing it, looking at the balance sheet, it's going to be a challenge. You just do it because it's the right thing to do. You put in programs that are competitive, that lead the market, that your associates need and want, and make it a better place to work. And if you follow that North Star, you're going to have some success. I know that's a challenge because not all companies have that sort of view of the total rewards landscape. But if you can, to the extent you can move yourself in that direction, I think you're in the right direction with regard to creating that type of work environment where people want to work.
Yeah,
And then Tina, Lisa hit something really hard, and I don't even think she hit it as hard as she realized she hit it. Okay. The whole concept is these activations, these, I have a lot of my old timers that pick on me all the time about having, oh, what's the flavor of the month this month? And it's really, belonging is the newest buzzword, but it's something that we've been doing for a long time. And it is, how do you work together? Belonging doesn't sit on top of this, it sits together. And then when Glenn was talking about the North Star, all of this is really the North Star. As you keep your team focus, as you're adding value, even if you do have an employee resource groups, they realize it without you having to bang the drum, show it to them, point it out in literature. It's a given. It's part of the material, part of the culture. And then how do we move everything forward to help our team members?
Mm-hmm.
Great job, Lisa. Great job, guys.
Thanks, Brian. One of the other things I want to comment from Glenn on is, every company's at a different place. Every culture is at a different place. Every budget at a company is at a different place in the initiatives and priorities. And wherever your company is at, you can make a difference and you can have an impact in this space. Even if you don't have budget for it, there are things you can do. Again, the employee experience. How are you treating the employee going on a leave, coming back from a leave? Can you weave into any enhancements in your policies and your programs, whether it's medical coverage around mental health, for example? Can you partner with talent development about manager training and helping educate your managers around psychological safety, around words they use, how they treat people? That will have an impact. And then again, partnering with DE&I if they have programs or initiatives, and where can you tie and work together to maybe leverage some of their budget to roll out some programs that really focus on mental health and well-being. And then just showing up to employee resource groups, sharing again the programs we offer and providing an ear to listen to their feedback has value in and of itself without spending any money. So again, looking at your organization and figuring out where you are able to make an impact.
Right. I think that's so important, what you've all been saying. And I do think that, as we continue on this journey, we do have to look and see. I think it was Brian that said they already had the technology in place in the telehealth and the teledoc, and that's available. And now we have that for mental health services as well. And then making sure that we can reduce any barriers to mental health services, whether that be through the telehealth or your EAP, making sure that the co-payments on your health insurance are in line. These are things that I think that many of us can do fairly easily, no matter what the size of our organization is. And like you talked about, training your managers and your supervisors to pick up and understand what are the warning signs or the early signs of someone who is becoming mentally fatigued or might have a mental health issue that we could possibly intervene and help with. And then again, wrapping up the whole cultural sensitivity to this whole topic. So definitely so much for us to consider as we develop programs. Speaking of developing programs, what are your most effective programs? What are some of the things that you've tried that haven't worked, and what have you had to change? What things did you, start and then say, we're going to tweak this a little bit, and now it's working really well? Be curious to hear that.
Tina, one of the things, and again, from the pandemic, we did was exactly what you're talking about. We did mental health safety training for managers and then followed it up with training for employees. And they were voluntarily voluntary, and they were highly attended and highly valued and went a long way. So they were very effective, and I recommend them. You can also do first aid training, which is a little bit different around mental health first aid training. So two different types of programs and approaches. So that worked well. What didn't work well was it was a one and done training. So we didn't systemically set it up for new managers and new employees. What we did do was we did have monthly sessions from that, though, with the expert who did the training. So every month we had a mental well-being webinar, live webinar. That was heavily attended as well, as because people felt it was a safe space to come and learn information, and it was tangible, hands-on information and things that they could do on different subjects every month based on feedback from the employees attending the sessions as to what the subjects would be. But it was a safe place for them to engage and share and ask questions. So that worked really well. And again, basic, simple, straightforward, but employees were highly engaged in it.
How about you, Glenn? We'll go reverse order.
Well, within the last, say, 2 years, in terms of programming we introduced, and some of you may have already done this as well, the lifestyle account, which is just incredibly popular. Never have I encountered a benefit that became third rail so quickly. You cannot touch it. It is loved by our associates. So we're up to between 85 and 90% utilization on that benefit right now. I can't think of another benefit that has that level of utilization. Oh, well, vacation maybe, right? But beyond that, I mean, that's just an incredible level of utilization. And I mean, it's not a cheap benefit, but in terms, they love it, absolutely love it. And it makes a statement on multiple levels about how New Balance feels about its associates and how we value their lifestyles and how we want to support them in whatever lifestyle they choose. And so it's just a great program. Love it. So
could you elaborate on what that program actually is for those of us that might not be familiar?
Sure. Basically, you set aside some funds. You usually have a third-party administrator for you. And you set up a definition of what you consider to be lifestyle-related expenses. And so ours is a very broad net. I mean, we do everything from veterinary care, pet care, your personal hygiene, like haircuts, massage, tax preparation, golf, tennis, skiing, what any clubs you're involved with. Really, it's hard pressed to find something that you do. We did exclude gambling. Okay. We did exclude, alcohol and certain things. So we're not subsidizing for those certain lifestyle expenses that some people might have. But generally speaking, it's a very broad net of expenses associated with. What we did was really key. A year ago, there was a hike in oil prices, and a lot of our factories are in central Maine, where the houses are generally heated in New England, you heat your house with heating oil. And the prices went through the roof. And so what we did, it gives you a lot of flexibility. We allowed now going forward that heating and cooling expenses and utility, we basically any utility expense is a lifestyle expense. So we were able to, with just an email to our administrator, to say, okay, effective January 1, we want heating and cooling and utility expenses to be included as eligible lifestyle expenses. So now all our good folks in central Maine, going paycheck to paycheck, we're now able to find an extra $1,000 to throw at their heating oil bills. And it was incredibly well received. So very, very light lift from an administrative perspective if you get the right administrator. But a lot of goodwill,
Wow. That sounds amazing. How about you, Brian?
Well, mine is not as good as his. We have it in Canada. We're still working on the US, but ours is a little bit different. So everyone has been doing financial well-being, and everyone brings in their planners. And the first mistake they make with all of our employees, our team members, our associates, is they use the word B for budget. And if you're working with an adult learner anywhere in the world and you say the B word, they've tuned out. We have folks at all socioeconomic levels. So we've put a lot of things in place not only for the 401k, the HSA, all the stuff they normally do, but we partner with Salary Finance. So instead of taking a 401k loan when you're in a jam, they're now FinFit. They will actually apply for a loan with them and work through not only the loan procedures, but work through the United Way for all the state and local things that they might be able to work on. 3 times in the last 2 years, we've hired team members that are homeless. So they don't qualify for FinFit because you can't get a loan until you've been with us for 6 months. So you have to have some kind of income history. So one of the things that we've done is we've partnered with Wealthy, and we have the Wealthy team actually contacting our new team member and putting a team of, basically they're your project managers to help this person with their issue in finding safe housing and coming up with an immediate plan, a 90-day plan, a 180-day plan. The one thing that Dawn has been consistent over the last 10, 15 years is we are advocacy super freaks, because we don't know what we don't know what we don't know. We're good at certain things, but we're not good at everything. So why not bring a partner in to help you with all of those things? So if your significant other is a veteran and having problems with the Veterans Administration, pick up a phone. You call them. They'll help you go through those types of things. You're having problems I have neurodiverse children. I have a Boy Scout troop that is almost all neurodiverse. So going through a lot of that stuff and getting that type of help for parents, or the nice, Glenn's going to smile when I say the nice version of the sandwich generation, which is we have to take care of our parents plus our neurodiverse and our challenged kids. And sometimes what I'm seeing a lot of lately is the challenged kids and the challenged grandkids all living with you in the same house. So how do we help people with all of that? And that's what we've really been focusing on. I mean, Tina, the newest one, I'll let you know in about 2 weeks. I'm even looking at discount groceries and grocery purchasing concepts because of the economy that we're living in. And everyone's, pointing fingers at where it started, whatever. I don't care. But what I do care about is challenging our folks and how do we help them make their ends meet?
Wow, I'd definitely be curious to hear more about that.
That's coming soon.
Security. Yeah, food insecurity is something that I'm sure touches all of us at some point or another.
Well, Glenn's brilliance with because our Canadian organization has the lifestyle events, but we have never put in any kind of gas, oil, or anything. That's utterly brilliant.
Yeah, and I've heard a couple themes that I heard that are resonating. Definitely, those employees, how do we support those employees in need? And I've heard, some other employers, a large employer, looking at kind of the groceries and money to help people who are really struggling, just keeping housing and food, and food insecurity is being an issue that, I look to, if we can't put money from a budget standpoint towards, paying for groceries or some of those expenses, what else can we do? And part of what we could do is, potentially helping refer them to community resources and government resources that do exist already. So, we have an hourly population of frontline employees that is struggling with those basic issues. And so how can we help make them aware of resources that do exist and can help support them over and above what we can do as an employer? So I've been toying with how to kind of create that type of a model that, again, is sharing information and directing people to additional resources outside the company. So I think that's important.
Lisa,
that's why we brought in the FinFit.
Yeah, we have something a little bit different. We have a financial assistance program for staff members, and they can apply for it. It does require a senior vice president's approval. But in order to get a grant, and it's up to $1,000, they have to demonstrate that they did try to access the community resources that are out there. because we have found that many do not realize how many community resources are available. And then when you're in need, you're not thinking very clearly about, I have to call this or I have to do that. So what we have done is establish that part of their application processes is showing us that you have attempted to find all these other resources. And if that's not available, then we provide that financial assistance. And I feel really fortunate that our organization is able to do that.
That's great. That's great to hear that you've got that in place, because it is that packaging up of offering an awareness of the community resources and additional company support. So I think that's really, really valuable.
I think it all goes in hand with our topic today, right? It's hard to ask for help. And so make it as easy as possible for your employees to ask for help, or for someone that notices that a coworker is struggling, for them to offer some assistance, I think is a really great thing to be able to do. I also want to mention, I don't know if you all are aware of the Mental Health America has a Bell Seal for their workplace mental health programs. It's just an award, and we've been fortunate to receive that award. What it does is it helps organizations really put a focus on workplace culture, asks questions about, does your health insurance meet and focus on mental health needs? Does it take a holistic approach to the social determinants of health? So if you're not familiar with it, it is out on the web. It's just a great organization to possibly partner with.
Tina, I'll mention another one that I've worked with is One Mind at Work. And that's another organization that their sole focus is mental health in the workplace and how we support employees. They've recently rolled out a mental health index assessment. It's kind of 10 different components that is broad reaching, not just kind of benefits and HR policies, that you can work with them and take the assessment. And then from that, they'll show you how you stand in terms of supporting employees around mental health as an organization. And then they help kind of guide you with some action items and steps you can take for any given area you're looking to make improvements. But they've been a great resource for me over the years of education around mental health. And they look at it from that holistic lens of not just the employer, but they're bringing in public policy and different groups and from different perspectives to all support and get to a better place around mental health.
I'd like to share another innovative program that we've done around mental health, and it's something we call Candid Conversations. Mm-hmm. And what it features is, on a quarterly basis, a senior executive from New Balance who gets on a webinar, a call like this, and they share their mental health issues. and the intent is to destigmatize mm-hmm. the mental health, right? I mean, because that's one of the problems that around it is that nobody wants to talk about it, and it's like, oh, something's wrong with so and so. So by having senior people in the company, and usually they don't do it alone. They usually do it with another associate, and they have what we call a candid conversation about issues and family issues and whatever. And it takes a lot, right? I mean, to and not everybody wants to do it, right? I mean, we don't make all our senior people do it, but we have some who feel strongly enough about mental health and feel good enough about themselves that they're willing to share what their experiences have been. And I think it's really gone a long way to destigmatizing mental health. We all have it. We all have issues in our families. We all have issues in ourselves, and it's okay. And let's talk about it. It's something that that's something to be ashamed of.
That's really great. We have an HR business partner that shares her story on mental health and talks with the staff, and it's been so well received. She talks with NAMI on a national level as well, but it does help to destigmatize it the more that we talk. I love that idea, Glenn. What other kinds of programs have you all used to communicate about mental well-being and to connect with our staff members or associates.
Yeah, kind of similar to what Glenn was talking about. I think that is so important if you have senior leadership on board around role modeling, around transparency. And we had not a formal program, but our senior leader share in a town hall just organically about mental health challenges within his family and how they were leveraging our programs to help support. And then he and his wife had a candid conversation, um, kind of interview style webinar, kind of sharing their struggles as two professionals raising two families that they brought together. So that vulnerability that leadership shows in sharing that goes a long way. Some of the more formal things we've done is conversation circles. So partnering with our DE&I team and our mental health provider and doing topics that are relevant, that are going on, that impact different groups and different populations, and having that expert talk, and then having a dialogue with potentially a senior leader or some of our managers to bring the subject out there, provide information and support. And again, just open the dialogue and have transparency. And all of that does go towards destigmatizing, openness, the whole concept of psychological safety. So the more you can have these conversations, and I think that word storytelling is huge because storytelling goes a long way, and people sharing their own personal stories can have a huge impact on how other people show up, how they feel supported, and how it can influence the company overall.
Taking a different approach. The biggest problem with the world in which we live in is we have so much information that we get into information overload and we don't know what we don't know what we don't know. So we partner with all of our resources, all 26 different providers, and we work on a thematic once a month. We reduce the noise getting to our team members. So remember, the Grinch Who Stole Christmas didn't mind Christmas. He didn't like the noise of the Pampukas and the Tamtukas. See, I gotcha. So the concept is we do a multi-prong approach. We do a newsletter that goes out every month, and it addresses different topics. Now, are there well-being topics in there? Yes, every time. The things that I've been marching against is this month, this is this national week. There's a week for everything. There's a donut day, there's cookie days, there's everything. So you use that once, but after then you have a challenge. So we do a monthly newsletter, and it's now in 2 languages. We're looking at a third, and that's for the team members to take home. It's a 1-pager, just front and back. Lots of QR codes. Thank you, COVID. We brought all that stuff back. With that, to engage all of the leadership, they have their own PowerPoint set with speaking notes. So they don't have to think about it. They don't have to read slides. They just have to read the notes. They incorporate it into their town halls and their manager minutes and other types of things. Along with that, here it comes, Lisa. I got to do it. We have now 146 video private YouTube channel.
Mm-hmm. I was waiting for that, Brian.
I know you were. And it is set up for different types of adult learners and different types of situations. Because being that we are in the bakery industry, we have folks that don't really leave. I mean, you're sitting down, Tina. I go from 18, just like everybody else, because bakery, you can't go younger than that, to 107 on our benefit plan. We have active 70 and 80-year-olds. So we have to look at how we deliver this stuff for where they're at, how they're at, and how they want to deal with it. We have folks that are driving, and I've been even going backwards in time and doing, we're looking right now at 401k, but we'll look at all bits of well-being for podcasts. Very piffy, very short. Have you thought about this? Here's where to get more information. So they can always go longer if they want to, but the biggest challenge is to get the information when you need it.
Mhm.
We've even embedded it in the back end of our payroll system. So when you bring your phone out to see your paycheck, and when the stuff happens, when you have the stress is what, between 10 and 3 in the morning? Are you going to be coherent to get onto your laptop and settle in and get the information? No. What if you're a production worker or a service worker? You don't have a laptop to do that. You don't have access to do that. We've embedded it in all of their phones so they can get at it for their phones so they can get the information quickly.
Yeah, I think,
That's great. Lisa?
yeah, kind of lessons learned and things worked and that don't work. As you mentioned, Brian, there's a theme for every hour of the year on something. And we were working to set up a, monthly well-being webinar from the benefits team. And then we were trying to make it global, and we were trying to make consistent global themes, and then that wasn't working. And we were kind of spending a lot of time and energy on something that may or may not have been of value, and we were making it too complex. And we were doing that, and then the DE&I team was doing their own themes, and then our corporate social responsibility team was doing their own themes. So too much information coming to employees, different themes on the same month from 3 different groups, and it was a disaster. And so part of the lessons learned was we started partnering across the organization. So then we had a theme for the month. DE&I had some support sessions. Benefits was promoting certain benefits, and then corporate social responsibility would have like a double match for that particular theme and those types of nonprofit organizations supporting it. So we were then holistically coming together, joining resources, but from the employee experience lens, then it was less noise and less was more. So that worked out really well. And then another thing we did as an organization was a manager toolkit that we put together each month. And again, good and bad. It was really good because every month managers were getting consistent slides to educate them on what was going on in the organization. And then we were highlighting benefits and well-being benefits consistently. And then they had slides that they could share with their teams. So here's your manager version of what you need to know, and here's what you can share with teams. So it was kind of plug and play to help communicate to managers and communicate to employees consistently. And that was really valuable and beneficial. On the negative, it did get a lot. So again, to Brian's theme of too much information, it got a lot of slides and a lot of information because we were trying to pack so much into it across all organizational departments and wanted them to know everything every month. So again, positives and negatives, but at the end of the day, I think it was a valuable resource.
Does anybody else want to comment on that? Just want to make sure you're good.
I'll just add that I think communications, which is I think was a lot of what Brian and Lisa were talking about, is huge. At New Balance, we have an internal corporate communications department that kind of serves as the traffic cop, because we have a lot of content coming out of human resources, and they're the ones who say, look, here's what's going to get published this week, here's what's not, and they package it up in a very slick and nice way that actually almost makes it look like human resources knows what they're doing, because it's a consistent messaging, and it's you don't get a lot of conflicting messages or overages where you get information coming from DE&I, you've got something coming from training and development, you've got something coming from benefits, and at some point, their eyes just glaze over and they just tune you out. So by having it all run through CoopCom, they're able to sort of pick the winners, and really sharpen the content, and just make the communications overall more effective. One of the communications is a monthly well-being posting that goes out where we, it's like it's not news, but I mean, you pick. We all have like 50 or 60 programs that we're probably administering. So every month we pick half a dozen or so, feature them, try to bunch them up in some similar content, and then get it out there and just try to keep it in front of the associates that, hey, these programs exist, and take advantage of them.
Yeah, and one of the things we did with something similar, Glenn, is going back to that storytelling promoting that particular benefit that month. And if we could interview an employee who utilized that benefit and throw in that storytelling.
Testimonial Tuesdays at New Balance. And we take a program and we,
Love it.
because my team knows who's happy, with a particular program. And we tap them on the shoulder and say, I know you like that experience with the financial planning company or whatever. Would you be willing to, do a 20-minute video on it and whatever?
Best advertisement there is.
Yep,
testimonial.
exactly.
Yeah.
And once you do the video, you can take it and you bolt it onto your benefits portal, right? So it becomes part of the whole marketing of the program. It's really neat. Yeah.
One final comment on communications. Things we touched on a little bit is words. And words matter. And when you look at mental health, words matter. And that was part of our mental health safety training of what words to use and not use to help really support employees. But also just the basics of, Brian, you talked about budget. Don't use the word budget because that has a trigger and people are going to tune out. And Glenn, you talked about, lifestyle funds. So I know, we've had challenges putting something like that together because of budget. But if you carve out an existing budget and call it something else, like a lifestyle fund, because it's basically cash compensation,
Yes.
employees love it. They're engaging with it. It really goes a long way,
Totally.
and has a big impact. So again, what you call things and how you present it can have a big difference.
Yeah. The lifestyle account is so cool. And I'll tell you one of the reasons why. We could have given everybody $1,000 raise. And from a tax perspective and from an income perspective, it would have been net zero. It would have been zero-sum game. Everybody gets $1,000 raise, but that $1,000 raise would have faded into the ether, and they would have totally forgotten about it. By making them jump through a hoop every year and actually get their receipt from the gym or get the receipt for the bike they bought or whatever their receipts from their hairstyle or whatever, it just brings it home that, hey, this is a pretty neat place to work. I get to get all this stuff reimbursed, and we get to basically take a bow every time they file a claim and take credit for that benefit, which would not have happened if we just said, okay, let's just give everybody $1,000. We're done.
Yep. There's your ROI right there.
Yeah. But I mean, I can't put a number to it, but I absolutely do think New Balance is a better place with that program than without it. No question.
Sounds like an amazing program. So I see that we are coming up at the end of our time today. And I just want to say, Glenn, Lisa, and Brian, it was really fun chatting with you today. And want to thank everybody that's joining us today as well. We're going to be doing a virtual question and answer session. So if anybody has any questions, we're asking that you submit them to connexpartners.com. And one of us, myself, Glenn, Lisa, or Brian, will be happy to answer those questions for you. Till we meet again, I just want to say thank you, and I hope you have a great day.
Thank you all.
Thank you all.
Thank you.